Hello, my name is Laura Howells and I'm a PhD student at the Centre of Evidence-Based Dermatology at the University of Nottingham, and I am one of the authors on a paper recently published in the British Journal of Dermatology titled "How Should Minimally Important Change Scores for the Poem Be Interpreted? A Validation Using Varied Methods." So why did we do this study? The poem, the Patient-Oriented Eczema Measure, is a patient-reported outcome measure of eczema severity, asking questions about 7 eczema symptoms over the last week, and it results in a score from 0 to 28. And in clinical practice and research, we're often interested in change in poem scores, particularly improvement. But if I say there was an improvement by 3 points on the poem score, an improvement by 10 points on the poem score, improvement at 1 point, it's difficult to know what that inherently means. And as an example on the vice versa, if you compare it to temperature, for example, if I tell you how much temperature change has occurred in Fahrenheit or degrees Celsius, we have a sense of what that means. But with this 0 to 28 poem score, a change on that doesn't have any inherent meaning. And so we have to do some research to try and give them scores some meanings that we can understand. And so how we did this was we calculated the smallest detectable change, which is the amount of change that can be seen beyond measurement error. And we also calculated what is called the minimally important change, which is the minimum amount of change that is seen as important to patients or clinicians. And we use a variety of methods to look at this, using both anchor methods, where we compare it to a different scale and anchor it based on a comparable scale, and distribution-based methods, which are often used for sample size calculations in clinical trials. And we pulled all this information together to build some recommendations on how to interpret the poem and the changes in the poem, and so you can find that in the paper. And the relevance of this to dermatologists, patients and researchers is that hopefully now we have a clearer guide and a better sense of what a change on a poem score really means, and we can start to use it in a more useful way.